Our next speaker is Dr. Raj Sherman. Now, you would think that Raj would be busy enough being a rookie MLA and a parliamentary assistant to the Minister of Health, but he's a devoted father, and he is still an emergency room doctor, only on Sundays though. So it gives him a chance to bring frontline advice right up to the legislature. We think that's fantastic. Please join me in welcoming Dr. Sherman.
I'd just like to tell you a little story about how people end up in our world where I work in the front lines. I'd like to tell you the story about a young woman. She's an immigrant woman with 3 young sons. She was born in a refugee village, and it was a difficult life. This is really the new face of our country. Difficult life for her over there, and came to this country in a small town, sewed clothes and cleaned hotel rooms. Her husband worked in the mill, like a good Albertan, good hard-working labor job. Her kids looked a little bit different. They knew they looked different. English was a foreign language to them. And so all alone, no family, no social support, no parents, no grandparents from that culture. Where our ancestors came from, there was a whole community here, nobody. And a hard-working husband who was never at home because he had to make ends meet for a hard-working family. And then not knowing the language, not knowing the culture, and looking different, and all the type of food they had, sometimes you smell a little different too. Kids would come home black eyes every, second week. And this was life for her family in the early 70s in this country, unfortunately. And then they both had to work hard, so none of them were able to spend enough time with the kids, and the kids were all alone. So these kids coming from a different culture into a whole different world have to adjust and cope with all these issues. Not to mention the stress of teenagehood, and just the anguish this mother would feel if she knew at one time that one of her children stood at the side of a highway, staring into headlights of a vehicle, contemplating taking his life. You have to ask yourself, what brings an individual to make that kind of decision? How much despair do you need to have? Somebody growing up in a real rough neighborhood has to have a ton of despair to bring themselves to that point in life. And this kid, nobody knew that this kid had a problem. He's really bright, had a 98.5% average in school, captained every sports team, always smiling, always laughing. This isn't the one you'd expect to have had a problem. This was the leader in school, and this kid jumped in front of a car. It's a cold, windy, rainy night. And that's sort of what happens when people come to us in emergency. If they're successful, they don't come to us. When they're unsuccessful, they come to us. And just to highlight the issue of mental health, there's one person at your table right now, 1 out of 10, that has a mental health issue right now. 1 out of 5 risk. I personally think it's 1 out of 3 because people don't fess up much. So you shook the person on one hand on your left and one hand person on your right, and then there's yourself. One of you 3 are today or tomorrow or yesterday are going to have some sort of mental health issue. If not you, the person you sleep with when you go home, if not them, one child down the hallway in your house, or your friend, or your brother, or your sister. We have 475 suicides a year in Alberta. Despite what we've done, the suicide rate has not gone down. Maybe it's a good thing what we've done, because maybe it would have been a heck of a lot higher. More Albertans die from despair than they do from car accidents in this province. That's tragic. You know what's even more tragic? It's the 60,000 children in Alberta in school who seek mental health services every year. We have 500,000 kids in school. 60,000 seeking mental health services. And the problem is, like Paula says, you look normal. Your body looks normal. It's easy when you're missing a leg or you're walking funny or you have a cast. Your body looks absolutely normal. It's just the brain's just not working too well. It's a chemical problem in the brain. It's a medical problem. But we stigmatize it by saying that guy's crazy or he's weird or he's different, don't want to be near him. It's a guy who sits in the back of the classroom really quiet, doesn't say anything. It's a person who sort of doesn't show up to work. The person sometimes sort of unloads off of you at work as they're a little cranky. And that's really mental health in a nutshell. Now I want to give you a little bit of hope. That young woman I told you about, that young woman was my mother with the 3 sons. And thank God they didn't have cell phones in the early 80s, because that son was me. The driver swerved. And I told my parents I just got hurt at sports at school. I told my teachers I fell off the balcony at home and Dad was building the house. I did die that day. I died that day. That was the old Raj. Then a new Raj was born. A good friend of mine gave me a Bible. So what I will say is, you know what? This is a problem that affects us all. It doesn't matter who you are. 1/3 of this room has had or will have a problem. And I thank you all. You are the people who make this society what it is. Now, the Premier has made a commitment to the vulnerable and the homeless and mental health. There's stuff government can do, and government is doing, and we need to do more. There's stuff the doctors and nurses need to do, but there's stuff society needs to do. Government can't fix everything. You guys are government. You elect us. We actually need your help. So a couple of things you can do today. One, I put my money where my mouth is. I got my checkbook out. So hey, it's a little challenge to the Premier and to His Worship Mayor Mandel. Are you guys in with it with me? All right, no pressure. Okay, please give of yourself, and there's a lot of work to do. This is for our kids. This is for young people. The center that they want to build is fantastic. Most of my friends committed suicide. We had 15 deaths out of 118 kids in the town that I grew up in. Half of them committed suicide. All my best friends are dead. They're either in jail or they're in the grave. And one guy, Malcolm, is homeless in Edmonton, 1,000 miles away. He's my patient. Good kid. He's not a bum. He's a good kid. He's a homeless drug addict in Edmonton. He's my friend. So not only do I ask you to give a check, I also ask you to make a commitment to hug 10 people every day. When you look at people, look them in the eyes. Take a serious little look in their eyes. If you don't see a flicker, hug them a little longer and ask them, really, how are you doing? Really. Don't be in a rush. Take that extra 5-10 seconds. If you're not doing well, give them a Bible or give me your number. Because you changed the life of one person. One person changed my life. I had the chance to change 100,000 people's lives. Imagine what we can do in this world together. If we all make a commitment to change one person's life. So thank you all. You've all been wonderful. I'll stop talking. God bless you. And with H1N1, don't do this. Do this. Have a good day.